Hi, welcome back. It's Dr. Perry and Dr. McIntosh here to talk with you for our series with the JEDI CNS Talkbacks. This time, for a change of pace, we are going to listen. We're going to sit back and listen. When I first came to the organization, one of the earliest meetings I was invited to was from a group of staff who had organized through the Racial Justice and Equity Task Force. This group had come together to look at what could be done on a staff level to build relationships. This group of leaders, of staff leaders, they came together, decided to listen to a podcast together, inviting other members of the DGSOM community to engage in some tough critical dialogue and to attempt to build community through that. And so the guests that we have here with us today will be talking us through this process that they went through and what their hopes are. And this was really special. Both Dr. McIntosh and I felt it was very special because people are constantly asking us, what can we do to be involved in JEDI work and this culture change work and CNS work? And the group that we're bringing forward today, they took that momentum and that initiative and ran forward and did that. So I hope you enjoyed listening to them as much as I enjoyed participating in the group.
The four of us are here today to tell you about a replicable experience that we facilitated last fall with 20 other staff volunteers. Before we get started, we will briefly introduce ourselves. My name is Amanda Fakih.
And I'm Stephanie Fisher.
Lindsay Herman.
I'm Mia McGill.
Thank you. So last fall, we created an experience to discuss 8 different episodes of Dr. Ibram X. Kendi's Be Anti-Racist podcast over Zoom. Each week, we began the sessions by briefly going over any current events that related to that week's topic before breaking out into smaller groups to discuss prepared questions or any thoughts that participants wanted to share. Throughout the experience, we prioritized remaining role agnostic or not making reference to the roles that we fill here at the School of Medicine in an attempt to prioritize the individual's experience and thoughts rather than the role that they may fill. Our objectives throughout this experience were to develop or further develop the knowledge and skills of each of our participants in their pursuit of being anti-racist. We strove to create a safe space where individuals felt comfortable making mistakes and sharing their thoughts in order to unlearn and relearn important truths. And ultimately, we sought to create an intersectional community here at the school. Importantly, none of us four that served as facilitators have any formal training in facilitation, nor do we by any means consider ourselves experts in this subject matter. We acknowledge that at the start of the experience and really leaned on each other and as well as the other participants for support and asked that we hold each other accountable to any mistakes that we may inadvertently make or any harm that we may inadvertently cause.
So Amanda has described sort of the what, but I guess an important underlying question is the why. About 2 years ago, or in the summer of 2020, after George Floyd was murdered, within the School of Medicine, a task force came together comprised of folks from leadership roles in various departments, as well as the dean's office, to focus on what we at the school could do to bring about racial justice and equity for staff specifically. I think a lot of folks are always, aware, especially through the kind of communication that happens and also the presentations that are made, that there's a lot going on as it relates to faculty, trainees, and other populations that are served by the school and health system. And we, no less important, wanted to make sure that there was attention paid to, the needs and desires of staff to be active and to, come together after this tragic event. So the group was commissioned to sort of work on initiatives that could be staff focused specifically. And actually over the course of a series of meetings came up with a lot of recommendations that today have been integrated or at least are very parallel to work that was developed and is going on across the school, including things like training, which I think and hopefully many have taken, the Transforming Our Communities training that came out over Cornerstone, as well as providing resources for folks to do self-education. But a lot of the things that were recommended, although, we think very strong recommendations, are the kinds of things that also take a lot of time to implement. There's a lot of alignment required and buy-in. And one of the things that the group really agreed on was in addition to all this important long-term work, there was a need to do something, more urgent or at least more timely. And the group that you see here sort of came together around trialing or piloting the discussion circle using Dr. Kendi's podcast as content because we really wanted to see what was possible. And we're just so grateful to the group of volunteers that joined us in that initial journey.
So based on our observed outcomes at the conclusion, what worked? So based on feedback that we received from participants, they found it to be a valuable experience. A wonderful community was created as a result. And thirdly, we leaned into our fears and were able to lean on one another and the community for support. In other words, we felt some trepidation about the unknowns of doing something like this, but we were able to push through that and do it anyway because it was important. And lastly, we tested and demonstrated our hypothesis that we can all do this work.
In addition, there were some other really important components of what worked that are sometimes hard to share with someone outside the experience, but I think I really want to emphasize that it was about the connections made and the emotional rawness and sharing that happened in the meeting. People sharing stories about their lived experiences, their cultural background. There was this amazing example that I learned from someone when they talked about respect for the earth. And one of the sessions focuses a lot on Native American and the stealing of land and the culture of respect for the earth. And one of the participants shared that when she was raised, her elders and her family taught her to always walk on the sidewalk. And if she had to walk on the grass, to apologize to the grass for having to have stepped on it. And it's just one of so many examples of the types of things that people shared from their own experiences and the rest of us got out of that time together. So it was both an emotional and an intellectual connection. In addition, there were some things that we are definitely still working to solve and to evolve about this experience. And one is definitely how to keep the momentum in the community we help build going. What do we do with all this cool energy at this place and time that came together? How can we move that forward into the future and not lose that? And also how to share our learnings and the learnings of everyone in the group to the greater community, to the full School of Medicine. How do we get the staff beyond this pilot and this experiment that we did to be able to have the opportunity for an experience like this, or to be inspired by an experience like this and do what feels best to them. So working to figure out how to repeat, replicate, and expand on what we've done is also an important effort we're still working on. One way that we're hoping to do that is we've been developing a resource guide, just discussing how we did what we did. And so we're going to be finding an opportunity to put that up on one of the DGSOM websites so the resource can be shared by anybody looking for this type of opportunity. And here's what we feel is like a triumphant picture, I think, of one of the last times our group got together with many of the folks able to be present. And I think this community picture that we have really encapsulates what we achieved and what we hope others can achieve as well. So thank you.
We are grateful for the time we had today to share a little bit about this experience with everyone, but we really want to make ourselves available if folks want to know more, whether it's just to hear about how it went or to try to replicate or do something similar in your local area. We're very willing partners in that. So we've put contact information up on the screen. Feel free to screen grab it or write it down, but we're all here again just to be of service to everyone who's interested and would love to partner with others who want to try this in their own community.
Wow. Dr. Perry, I hope that you found that as intriguing and compelling as I did. That was really an amazing session. I really loved how our presenters saw a problem and they sought to address the problem. It's not like our presenters had social science PhDs or anything like that, but they connected resources, they had an idea, and they pursued it. And I just love the spirit in which they pursued it. They said, we don't purport to be an expert, but we want to have this dialogue and this conversation. And in the spirit of that, I think came from some powerful learning for the participants and some a real stake in the ground about what this organization is about. Like when we think about racial equity and our commitment to racial equity, here's an amazing example from our staff. And so loved the effort. In the future, we're going to be highlighting other programs like this as well. So we hope that you'll tune in for other future sessions as well. And so thank you so much for tuning in today, and we look forward to the next time.